Hello, my name is Dr. Robert Pitceathly. I'm a Neurologist and Principal Investigator at UCL Queen Square Institute of Neurology. I'd like to start by thanking the organisers of this meeting for inviting us to present our e-poster entitled A Randomised Placebo-Controlled Phase 1A/1B Study to Assess the Safety, Tolerability, Pharmacokinetics and Pharmacodynamics of KL1333 in healthy subjects and patients with primary mitochondrial disease. This is a presentation of a phase 1 study conducted to assess safety, tolerability and pharmacokinetics of KL1333 in healthy subjects and primary mitochondrial disease patients, for which I was chief investigator for the patient part of the study. Exploratory objectives included assessment of pharmacodynamic properties of KL1333. 2 mitochondrial disease specialist centres in the UK were involved in the patient part of the study at UCL and Newcastle. The study was sponsored by the biotech company Abliva. KL1333 is an NAD plus NADH modulator which has been designed to restore the NAD plus NADH ratio in mitochondrial diseases and thereby improve the energy metabolism and stimulate mitochondrial biogenesis. The study adopted a hybrid design and included 8 cohorts of healthy volunteers and 1 cohort of genetically confirmed primary mitochondrial disease patients. KL1333 was dosed up to 10 days with increasing doses from 25 to 250 milligrams daily to evaluate the maximal tolerated dose in healthy volunteers. There were no serious adverse events or safety signals. Tolerability was limited by mild to moderate gastrointestinal-related side effects, such as nausea, stomach discomfort, and diarrhea. Tolerability was improved by dividing the daily dose into 2 to 3 administrations. There was no substantial difference in drug uptake if the compound was taken fasted or with food. Based on the healthy subject data, 50 milligrams once daily was selected as the dose for the patient cohort, and this was the first time the compound had been evaluated in patients. These are the baseline characteristics of the 8 patients included in the study. It was a double-blinded study with 6 patients receiving active compound and 2 receiving placebo. The study included patients with different mitochondrial DNA-related multi-systemic diseases. This slide summarizes all adverse events reported in the study. Most adverse events were mild. Those occurring in more than 1 subject included fatigue, feeling hot, nausea, and pain in extremities. There was 1 subject with moderate adverse event in the placebo group and 1 subject with moderate to severe adverse event in the active group. The latter experienced facial pain and intermittent non-specific malaise. Patients were assessed with 2 fatigue scales and 1 functional test. The NeuroQol short-form fatigue scale with 7-day recall of fatigue symptoms and impacts on activities on daily living was assessed at baseline and on the last day of dosing. The sit-to-stand test was performed on the same days. Daily fatigue impact scale was assessed daily. Mean differences favoured the active treatment in all 3 assessments, and interestingly, the subjects with the largest changes had highest blood concentrations of KL1333. Biomarkers, including lactate and pyruvate, were assessed in the study given their relevance to primary mitochondrial disease and to NAD plus NADH redox state. However, they varied substantially due to multiple factors. In healthy volunteers under control settings, fasted overnight as well as after dosing, there was a trend towards a decrease in lactate 30 minutes to 2 hours after dosing. Data show mean values from day 10 in cohorts with 50 milligrams 3 times a day and 75 milligrams twice daily dosing. In all other cohorts, biomarkers were only assessed prior to dosing in the mornings, and there was generally quite high day-to-day variability in these biomarkers. In patients, we're looking at lactate pyruvate ratios. There were opposing trends comparing baseline and day 10 samples with a mean increase in the 2 placebo subjects versus a mean decrease in KL1333 treated subjects. In summary, KL1333 showed a good safety profile. The main dose-limiting tolerability was gastrointestinal side effects, and this was improved by dividing the daily dose. This study was the first to evaluate KL1333 in patients, and there were encouraging signals and trends towards improvement in the fatigue scales and the sit-to-stand test included in the study. The data support the ongoing evaluation of KL1333 in a phase 2/3 efficacy study, which is planned to start later this year. Thank you very much for your attention.